Okay, so good morning, everyone. My name's Andrew Thompson. I'm part of the team at PhysioCare Rehab. And this morning, I'm just going to do a short presentation for you on the use of Shockwave for lateral and medial epicondylitis, more commonly known in sort of the wider world as tennis and golfer's elbow. So, first of all, just to give you a bit of a background for those of you who don't know, or to give some more information for those of you who maybe do have a bit of an idea about it. But what is extracorporeal shockwave therapy? Can be abbreviated to ESWT. You might see it written like that in some places. So, ESWT is a safe, non-invasive therapeutic technique. It is essentially the use of shockwave. So, shockwaves which you administer to someone through a handheld device, which we have in clinic. You can use it on a variety of injuries, which I'll go on to talk about a little bit more further in the presentation. And essentially, as I say, it's the introduction of shockwaves to a targeted area of tissue in the body. That said waves are approximately 1,000 times the pressure of an ultrasound wave, which in years gone by has been used as a different technique. And the main goals of ESWT in a musculoskeletal sense, so when for treating muscular or bony pathologies such as lateral and medial epicondylitis or tennis and golfer's elbow, are to reduce pain and to increase function. So essentially to do both of those things, which can obviously massively help in the rehabilitation program and help to progress during your rehab quicker than conventional means not using therapies such as ESWT. So a little bit more detail about the specific pathologies that we're looking at the use of ESWT for here. So lateral and medial epicondylitis, some of you might be aware, but in the wider world, sort of the non-practitioner world, if you like, a lot of people would refer to them more as tennis or golfer's elbow. This name is a little bit misleading because actually the vast majority of people who present with this condition, if they have lateral epicondylitis, are not primarily tennis players or racket sport players, and for medial epicondylitis, they're not usually golfers. The most common presentation for things like this is people who are utilizing their hands and their wrists and flexing and extending their wrists very commonly for things like work. So you might see a lot of laborers or other sort of physical jobs which involve a lot of lifting or manipulation of your hands and wrists. And it is primarily a chronic or insidious onset. So if you don't know what that means, that essentially means that you don't have one clear moment where you feel, oh, I've pulled said muscle, you might think, or anything like that. It tends to come on over time as you subject the tendons of your wrist flexors and wrist extensors to repeated loads. Which essentially causes these big flare-ups at the tendon at either the lateral or medial epicondyle of the elbow. As I say, for lateral epicondylitis, so that's sort of on the outside point of your elbow here, that happens primarily due to overuse of the wrist extensors, with the most commonly affected one being a muscle called extensor carpi radialis. And for the medial epicondyle, which is the other point on the inside of your elbow, that happens primarily from overuse of the wrist flexors. And similarly, the most commonly affected muscle or tendon at that point is the flexor carpi radialis. So what does research say about the use of shockwave therapy for treating the conditions that I've just discussed? Well, in a more general sense, a 2021 study found that shockwave therapy is gaining popularity and can be used to treat chronic injuries in multiple areas. And in this study, it did explain that that includes the lateral elbow. So the point on the outside of your elbow, which I was talking about just a moment ago. Some research back in 2012, so about 10 years ago now, found that shockwave therapy has been used as treatment for MSK conditions for over 20 years. So at the time of that study, it was 10, but obviously now it's 20. Important to note that in that time, having read lots of the research myself, they're finding that there is next to no adverse effects or side effects or risk with it. It generally is, as I said at the early on, it's very non-invasive. Almost all people find it quite therapeutic and quite pleasant. The only real contraindications or things to be worried about are things like being allergic to the gel that you might use, because you have to use a lubricant on the surface. So it's just making sure that you're using one which works for you. And yeah, so in that sense, it's very positive. Also, shockwave therapy, research has found that it can relieve pain and restore function better than many other treatment modalities. So that Yao et al. Study in 2020 looked at things like the use of ultrasound as a therapy technique, which has become a little bit outdated in recent years, but in the past, people saw that as possible. But as I say, shockwave therapy over time, especially for these sort of long-term chronic tenderness issues, research is just finding more and more that it's a fantastic therapy technique, and it's something that we obviously offer at PhysioCare. So if you know that you're presenting with lateral medial epicondylitis or tennis golfer's elbow, as I said, or any other sort of similar soft tissue long-term issue which you just felt creeping on over time, possibly as a result of a change in your load or extended load, then it's something that we can definitely help with, and the research suggests that coming to us would be of benefit to yourself or to someone else if you know someone else suffering with an issue like that. So what about the actual practical application and effects of shockwave therapy? So research suggests, and all the experts who sort of talk about this stuff routinely would suggest that it's important that you are regular in the period that you're using it. So what I mean by that is getting weekly sessions in, because this has been found to be far more effective than just using 1 or 2 sparse sessions over an extended period of time. So the suggestion is that you do one session per week for a minimum of 4 weeks. Some people might do it up to 8. The sessions are really quick and really easy, generally only last 10 to 15 minutes, if that. And it just involves the use of the machine. So you can see in the picture there, that's a good example of exactly what it would look like at the lateral elbow. So that sort of handheld item is connected to a bigger machine, and it delivers the shock waves over the targeted area, as I say, for approximately 10 minutes. Essentially what that does, the introduction of said shock waves to the area of soft tissue, stimulates a reaction in the body of an increase in blood flow to the affected area, which essentially just helps to aid the healing process. I won't go into too much detail about the exact nature of that and what that exactly means, because that's something that I would explain to said person in clinic. But essentially, the introduction of these shock waves, as I say, regularly, week on week, for at least a few weeks in a row, can help to aid the healing process. And one of the real big positives of using shockwave therapy is that it's been found to reduce pain. And in the limited experience that I've had with patients, I found that that's definitely been the case as well. So something else that's really important that myself or anyone at PhysioCare, or most physios I would hope would say, is that as great as shockwave is and the brilliant positive effects that it can have, it can be even it can work even better in terms of long-term rehab, if you prescribe associated and additional exercises. So shockwave therapy, research suggests, practitioners have found that it is most effective when combined with good exercise. So the shockwave will help to improve the healing process, but the exercises are what's going to improve the strength of said muscle. And by improving the strength of said muscle, so in this presentation, we're talking specifically about the wrist extensors and flexors, so the muscles of the forearm here that will be affected at either the lateral or medial epicondyle of the elbow. By strengthening these muscles alongside using the shockwave therapy in the healing process, you essentially reduce the likelihood of this coming up again. So people who, as I said earlier, present with these conditions, quite often it's linked to work that they're doing. So it's not as if you can remove yourself entirely from that or even partly a lot of the time to reduce the chance of a flare-up happening. People are going to need to go back to it. So by strengthening these associated muscles alongside the healing process, it means that you give yourself a better chance of going back to the load, which maybe has played a part in spiking this condition to happening in the past, and you reduce the chance of that flare-up happening again. So it's really important that we do that as well. And these are just some pictures. Obviously, this isn't exclusively what we do, but just to give you an idea of some things that we might do for medial and lateral epicondylitis. You can see there some pictures of some of the exercises. So the first ones on the left obviously don't have a resistance, so they'd be slightly earlier stage, and then we might introduce the use of a resistance band or even a weight further down the line. And you're just looking at putting that wrist through flexion and extension to stimulate those muscles that I've described earlier on in the presentation. These are just a list of some of the references that I use, some of the research that I've referenced earlier on in the presentation. I hope you enjoyed it. As I said earlier, if you think that using shockwave therapy following this presentation is something which might be good for you or someone you know, if you've suffered with lateral medial epicondylitis or any other sort of long-term issue, please don't hesitate to get in touch. We'd love to help you out. Thanks. Bye-bye.